Your baby's brain starts forming at week 3 of pregnancy. By the time they're born, it will contain 86 billion neurons. Every single one built from what you eat, how you sleep, how you manage stress, and the environment you live in. Let's get into it. 1. Feed your baby's brain before it forms. Nutrition is a foundation everything else builds on, because your baby's brain is built entirely from raw materials. Here are some nutrients your baby needs, and why. Folate must be present before week 3, before most women even know they're pregnant. It closes a neural tube that becomes your baby's brain and spinal cord. The NHS recommends 400 micrograms daily from before conception. Food alone is rarely enough. Supplementation is essential. DHA, found in oily fish like salmon, mackerel, and sardines, is a primary structural fat of your baby's brain. The brain's gray matter is 50% fat by dry weight, and DHA is its dominant component. 2 portions of oily fish per week is the NHS recommendation. Choline, found in egg yolks and liver, builds your baby's hippocampus. That's the memory center. Studies show that higher choline intake during pregnancy produces measurably better memory performance in children. Iron supports myelination, the coating on nerve fibers that makes the brain process information efficiently. Iron deficiency in pregnancy is the most common nutritional deficiency globally, and its effects on the baby's brain are well documented and long-lasting. Get your iron levels checked at your booking appointment, and again at week 28. Iodine, found in dairy, white fish, and eggs, produces the thyroid hormones that regulate your baby's brain development throughout all 3 trimesters. Antioxidants, from blueberries, pomegranates, strawberries, and leafy greens, protect developing brain cells from oxidative damage throughout pregnancy. The fetal brain actually develops in a naturally low-oxygen environment designed by nature to protect it. However, metabolic processes still generate damaging byproducts, and antioxidants step in to neutralize those byproducts continuously. So you should eat oily fish twice a week, eat eggs regularly, vary your fruit and vegetable intake as widely as possible. Discuss your specific supplementation needs with your GP or midwife. Nutrition requirements vary based on your individual health history. 2. Manage your stress. When you experience chronic stress, your body produces a hormone called cortisol. Cortisol crosses the placenta. Persistently elevated cortisol exposure in the womb is associated with reduced hippocampal volume, differences in brain structure, and increased stress reactivity in children, effects that have been measured years after birth. Untreated anxiety and depression during pregnancy are medical conditions with direct biological effects on fetal brain development. Untreated maternal depression reduces placental blood flow, disrupts sleep, and impairs nutritional intake. 3 simultaneous impacts on your baby's brain. Speak to your GP or midwife without delay. There are options at every severity level. Social connection is protective. Biologically, not just emotionally. Regular contact with people you trust reduces cortisol levels measurably. Isolation during pregnancy is independently associated with elevated stress hormones and poorer birth outcomes. If your social network has reduced during pregnancy, actively rebuilding it, a prenatal class, an online community, regular contact with a trusted person, is not optional self-care. It's brain protective behavior. Relationship stress matters more than most people acknowledge. High-conflict home environments during pregnancy are associated with elevated fetal cortisol exposure. It is important to recognize that your home emotional environment is a direct biological input into your baby's development and treat it accordingly. 3. Treat sleep as non-negotiable. During sleep, your body repairs placental cells, releases growth hormone, and regulates the hormonal environment your baby is developing in. Poor sleep quality in pregnancy is associated with reduced placental efficiency and impaired fetal growth, not just maternal tiredness. Sleep on your side from week 20 onward. This is specific and important. Side sleeping improves blood flow through the inferior vena cava, the large vein returning blood to your heart, which directly increases the volume of blood reaching the placenta. The difference in placental blood flow between side and back sleeping is measurable on Doppler ultrasound. Sleep disorders in pregnancy are underreported and underdiagnosed. If you're snoring heavily, waking gasping, or feeling unrefreshed regardless of hours slept, Mention to your midwife. Pregnancy-related sleep apnea reduces your oxygen levels during sleep, which reduces fetal oxygen supply. It's not a comfort issue. It's a clinical one. Aim for 7 to 9 hours per night. Create a consistent wind-down routine, the same time, the same sequence, because your body's sleep response is partly conditioned. A routine trains your nervous system to transition into sleep more efficiently, which matters increasingly as the pregnancy progresses and physical comfort reduces. Subscribe. This channel covers pregnancy science across every trimester. 4. Move your body every day. Moderate exercise during pregnancy increases blood flow to the placenta, improving the delivery of oxygen and nutrients to your baby's brain directly. Studies have found that babies born to mothers who exercise regularly during pregnancy show better performance on cognitive testing in early childhood. The key word is moderate, not intense, not competitive, not the same level you exercise at before pregnancy, because your body's capacity changes trimester by trimester, and what's appropriate at week may 12 not be appropriate at week 32. Speak to your GP or midwife before starting or continuing any exercise program. They will advise on the specific types, intensities, and durations appropriate for your individual pregnancy, based on your health history, your trimester, and any complications. Move your body often. Let your provider tell you how much. 5. Protect your baby's environment. Your baby's brain doesn't just need the right nutrients. It needs the absence of the wrong things, and several of the most common environmental exposures in a modern UK or Canadian home carry real, documented risks to fetal brain development. Household chemicals. Some cleaning products, paint fumes, and pesticide residues contain compounds that cross the placenta and affect the developing nervous system. Ensure good ventilation when using cleaning products. Avoid repainting rooms in the first trimester when the brain's foundational structures are forming. And where budget allows, choose organic produce to reduce pesticide exposure. Plastic-associated chemicals. BPA, phthalates, and common replacements like BPS and BPF found in some plastics are endocrine disruptors. They interfere with thyroid hormones, which regulate fetal brain development. Avoid microwaving food in plastic containers, even if they claim to be BPA-free. Switch to a glass or stainless steel water bottle. And reduce canned food consumption where possible, since many can linings still contain these compounds. Air pollution. Particulate matter from vehicle exhaust crosses the placenta. Research published in multiple peer-reviewed journals has linked prenatal air pollution exposure to reduce white matter development and lower cognitive scores in early childhood. Avoid walking along busy roads during peak traffic hours. Keep windows closed on high pollution days. Check the UK Air Quality Index or Air Now in Canada, and ventilate your home in the early morning when traffic pollution is lowest. None of these steps require a complete lifestyle overhaul. Each one is a small, practical adjustment that reduces your baby's exposure to documented neurotoxic compounds during a window when the brain is most vulnerable to them. Attend every scheduled prenatal appointment. Many of the conditions that silently threaten fetal brain development, preeclampsia, gestational diabetes, placental insufficiency, produce no symptoms you'd notice at home. Your midwife's appointments are the only mechanism that catches them. Do not skip them.